Hello everyone. So today's topic of discussion is just wait to check my voice. But okay. Hi Ashley. The topic of discussion is minerals. So this is important topic. From this topic, you may get LAQ long answer question or you may get a assay type clinical case. There are number of clinical cases from the mineral metabolism, and this is quite important topic. And for the viva purpose, this is important topic for the viva purpose. So we divide this mineral into two important sections, that is major elements and minor elements. Major means when the requirement is more than 100 milligram per day, when the RDA recommended daily allowance is more than 100 milligram per day, they are known as major elements. And when the requirement is less than 100 milligram per day, they are known as the minor element or trace elements. From this chapter, see, it is NMC competencies 6.9 and 6.10. 6.9 covers the functions, metabolism, and homeostasis of different minerals. Functions, metabolism, and homeostasis. Actually, it includes the RDA, that is recommended daily allowance, biochemical functions, deficiency manifestations, dietary sources related with the particular mineral. And the 6.10, it is about the disorders, means the when this mineral level increases or decreases, what are the different condition and what are the different important disorders which are related with this topic. So disorders related with the mineral metabolism. So this is in the NMC competencies in the first MBBS curriculum. Now there are two important LAQ from this chapter, two important LAQs. One is on the calcium. This is on the calcium first important, that is RDA sources, then biochemical functions, deficiency manifestations, and homeostasis of the calcium, how calcium is regulated in our body. So that is the first important LAQ. And second, from the minor elements or the trace element, that is iron, again important question. And the iron deficiency anemia is the important clinical case. Iron, absorption of the iron, the functions and deficiency manifestations of iron, how it is regulated in our body, and the case, clinical case, iron deficiency anemia is important from this chapter. Okay, so these are the two important LAQs, that is calcium and iron. There are number of SAQs, short answer question from this topic, that includes the zinc, that includes copper, that includes iodine, then phosphorus, sodium, potassium. Sodium potassium is also a part of LAQ, important LAQ, that is electrolyte balance, water and electrolyte balance. Okay, so these are the important clinical cases from this chapter. First one is the tetany, where you will get carpopedal spasm. So there is carpopedal spasm. So typical position of the hand like this means the flexion of the wrist joint and flexion at the metacarpophalangeal joint and extension of the interphalangeal joint. This is the carpopedal spasm, typical position of hand in the tetany when serum calcium level, it is related with the calcium, when calcium level goes below 6 milligram per deciliter. Normal calcium is 9 to 11 milligram per deciliter, but when it goes below 6 milligram per deciliter, it causes the spasm, that is carpopedal spasm. Then iron deficiency anemia is the important clinical case in which there are number of symptoms and laboratory findings. So we'll discuss that in the iron deficiency anemia, different sources for the iron, RDA of iron, how it is absorbed from the intestinal mucosal cell, and the iron deficiency anemia we will discuss. Then fluorosis, it is related with the fluoride, excess of fluoride intake causes the fluorosis. Acrodermatitis, this is related with the fluoride, this is related with the iron, it is quite clear from the name. Acrodermatitis enteropathica, it is related with the zinc deficiency. So It is a disorder in which there is involvement of acral parts of the body, and there is rash, dermatitis, which typically involves the mouth, nose, finger, toes, and perineal areas. So this is acrodermatitis enteropathica, manifestation of zinc deficiency. Then iodine deficiency goiter, it is because of deficiency of iodine in the food content. And the Wilson's disease and Menkes disease, this is related with the copper. This is related with the copper. So these are the important clinical cases from the mineral topic. The most important is the iron deficiency anemia. This is important clinical case, iron deficiency anemia, then Wilson's disease, then acrodermatitis, then iodine deficiency goiter, and the tetany. These are the very, very important cases for the university examination. So we'll discuss the major and minor elements today. We'll particularly focus on the four important characteristics related with the mineral. First one is the RDA, that is recommended daily allowance. Second one is the sources. Third one is the biochemical function, and fourth one is the deficiency manifestation. So we'll discuss these four important. We'll discuss this mineral under these four important headings. Okay. Now see, major elements, major when the requirement of this element, it is more than 100 milligram per day. When it is more than, not here, it is day, per day, it is not deciliter. More than 100 milligram per day, they are known as major elements, that is calcium, phosphorus, magnesium, sulfur, sodium, potassium, chloride. So if you want to remember the RDA of these different minerals, ट्राई टू मेक ए चार्ट. इसका एक चार्ट बना के रखना है ताकि आपको आरडीए याद रहे. और आरडीए स्पेसिफिकली एक या दो मार्क तो भी कैरी करता है. और सोर्सेस, सोर्सेस भी, सोर्सेस को भी 2 मार्क्स रहते. तो इट इज वेरी वेरी इंपॉर्टेंट टू रिमेंबर दिस आरडीए. सो कैल्शियम, इट इज नियर अबाउट 800 milligram per day. Phosphorus, it is equal to the calcium, that is 500 to 800 milligram per day. Magnesium requirement is 350 milligram per day in adult. Sodium requirement is uh, 2 to 5 gram per day. Potassium, it is again 2 to 5 gram per day, or 2 to 4 gram per day. And chloride, it is equal to sodium, that is 2 to 5 gram per day. So this is RDA of this different. So in case of sulfur, it is not important. So calcium 800 milligram per day. Remember, it is in milligram calcium. 800 अगर ग्राम बोलोगे तो वो 1 किलो के आसपास चला जाता. सो 1 किलो कैल्शियम कौन खाएगा दिन में, है ना. सो इट इज 800 मिलीग्राम पर डे कैल्शियम. फॉस्फोरस 500 to 800 milligram per day. Magnesium, it is 350 milligram per day, 300 milligram per day in females. Sodium 2 to 5 gram per day, it is in gram, 2 to 5 gram per day sodium. And for hypertensive history, means if the family is having the hypertensive history, it is less than 1 gram per day sodium. Potassium 2 to 4 gram, chloride 2 to 5 gram per day. So this is RD of this different food stuff. All of you know that calcium, phosphorus, magnesium, these are important for formation of bones. These are important for formation of bones and teeth. Calcium, phosphorus particularly, they are important for the formation of bone. They are important for the mineralization of bone. They are important for the hydroxyapatite formation, and it bones become stronger because of mineralization, because of calcium and phosphorus. So what are the dietary sources of this calcium and phosphorus? व्हाट आर द डाइटरी. कितने सारे एडवर्टाइज आते हैं टीवी पे कैल्शियम और फॉस्फोरस से रिलेटेड, कि इसमें इतना कैल्शियम है, इतना मिलेगा, बच्चों को ये देने से ये होगा, इसमें ये पाउडर मिलाओ, वो पाउडर मिलाओ, ऐसे कितने तो भी एडवर्टाइजमेंट आते हैं. और जब एक्चुअली पेपर में ये क्वेश्चन आता है, राइट अबाउट द डाइटरी सोर्सेस ऑफ कैल्शियम, हम प्रॉपर लिख नहीं पाते. हम लिखते हैं सीरियल्स, पल्सेस, ऐसा हम इसमें लिखते हैं. व्हाट इज इंपॉर्टेंट डाइटरी और रिच सोर्सेस ऑफ कैल्शियम एंड फॉस्फोरस? Just wait. Yes, correct. Hi Srimati. Hi Shiv Kumar. Srimati Shiv Kumar. Hi Vinay. Asian disease. So this is important. यस, कितने सारे एडवर्टाइज आते हैं जिसमें इसमें कैल्शियम है, फॉस्फोरस है, इसमें डीएचए है, ऐसे ऐसे कितने तो भी एडवर्टाइज आते हैं। ओके, सो कैल्शियम फॉस्फोरस, तो यहाँ पे आपको मिल्क एंड मिल्क प्रोडक्ट्स यहाँ पे लिखना पड़ेगा कैल्शियम फॉस्फोरस में। फिर सोडियम, सोडियम कहाँ पे रहेगा, सोडियम का सोर्स क्या है, यहाँ पे भी यही लिखोगे, मिल्क, मीट, सीरियल्स, पल्सेस, वेजिटेबल। सोडियम क्लोराइड मतलब क्या होता है, सोडियम क्लोराइड क्या होता है, सोडियम क्लोराइड क्या लिखना है, टेबल सॉल्ट लिखना है, सिंपल है, टेबल सॉल्ट। टेबल सॉल्ट, सोडियम क्लोराइड। पोटेशियम की इसमें आपको फ्रूट्स लिखने हैं, स्पेसिफिकली बनाना और टेंडर कोकोनट। बनाना, टेंडर कोकोनट मतलब आइसक्रीम नहीं, टेंडर कोकोनट वाटर या टेंडर कोकोनट है, it is important source of potassium and the various fruits। so जब भी ये लिखोगे, मतलब डिफरेंशिएटिंग लिखोगे, जो पहला पॉइंट रहेगा वो आपका इंपॉर्टेंट चाहिए, क्योंकि वो पहले दूसरे पॉइंट ही एग्जामिनर पढ़ेगा कि इंपॉर्टेंट सोर्सेस है। बाद में तो उसको ध्यान में आ जाएगा, सीरियल, पल्सेस, वेजिटेबल, मीट, मिल्क, एग, ये तो हम लिखने ही वाले। लेकिन इंपॉर्टेंट क्या है, सोडियम में आपने आपका टेबल सॉल्ट आने को होना, पोटेशियम में आपके फ्रूट्स आने को होना, क्लोराइड में आपका टेबल सॉल्ट आने को होना, है ना। सो कैल्शियम, फॉस्फोरस, मैग्नीशियम, सल्फर, मिल्क, मिल्क एंड मिल्क प्रोडक्ट्स, फिर मीट, फिर एग, फिर ग्रीन लीफी वेजिटेबल, ऐसा एक सीक्वेंस में आपका डाइटरी सोर्सेस आने को होना। सो विल डिस्कस द इंपॉर्टेंट मेजर एलिमेंट्स एंड हियर द क्लिनिकल केसेस रिलेटेड और कैल्शियम से रिलेटेड क्या है, titani, it is titani, not titanus, titani, it is carpopedal spasm, typical position of the hand, this is position of hand, it is medical emergency, so there is spasm of the muscles, so carpopedal spasm, it is known as carpopedal spasm. Now see this case, a 62-year-old lady came to emergency department with complaint of muscle cramps. So muscle cramps, muscle twitching, and carpopedal spasm. See, carpopedal spasm in the left hand. She had one episode of seizure few days back. Serum calcium level was 6 milligram per deciliter. Serum calcium level was 6 milligram per deciliter. Now remember this. These are the symptoms of hypocalcemia. Cats of hypocalcemia. Convulsion, arrhythmias, tremor, then tetany, spasm, stridor. Convulsion, arrhythmias, tetany, tremors, spasm, stridor. Okay, laryngeal stridor. Okay, so these are the symptoms of hypocalcemia. Carpopedal spasm, when the calcium level goes below 7 or below 6 milligram per deciliter, there is position of the hand. This is known as carpopedal spasm. Okay, so this is because of which mineral deficiency? See, calcium deficiency causes carpopedal spasm. Zinc deficiency causes acrodermatitis enteropathica, the rash around the mouth, nose, finger, toes, perineal areas. These are particularly involved in the zinc deficiency. There is, in the zinc deficiency, there is impaired spermatogenesis. In zinc deficiency, there is alopecia. In zinc deficiency, there is delayed wound healing. So this is mnemonic to remember the zinc deficiency, that is diarrhea, alopecia, dermatitis, delayed wound healing. Diarrhea, alopecia, dermatitis in the zinc deficiency. Copper deficiency, it is related with the copper is related with the Wilson's disease. Copper is related with the Menkes disease. Copper is related with the anemia. Copper is related with the large vessel involvement and severe abnormalities. Copper. Calcium, it is related with the carpopedal spasm, convulsion, arrhythmias, tetany, tremors, stridor, and spasm. And iodine, it is related with the iodine deficiency, goiter. It is related with iodine deficiency, goiter. So you may get this, you can get this case as a clinical essay type question, or you can get a iron deficiency anemia case, which is an important. So these calcium and iron, these are the important LAQs from this chapter. Also important questions are zinc, copper, phosphorus, zinc, copper, phosphorus, and sodium, potassium, chloride. These are the part of electrolyte balance. So water and electrolyte balance, it is important LAQ. Sodium and potassium, sodium, potassium, chloride. Okay. Now see, we'll start with the calcium. So calcium, major elements. The body content of the calcium is 1 to 1.5 kg. Total body content of calcium is 1 to 1.5 kg. Of this 1 to 1.5 kg, the 99% it is present in the bone and teeth. 99% of the calcium it is present in the bone and teeth, and only 1% is present in the extracellular fluid. Only 1% in the blood. Of this 1%, the 50% calcium is ionized calcium. It is known as ionized calcium. 40% is protein bound, and 10% it is with other ions, that is lactate, bicarbonate, ion. It is complex with the other ions. So of this 1%, 50% is ionized, 40% is protein bound, and 10% is with the other ions. हम लेबोरेटरी में जो मेजर करते हैं दैट इज सीरम कैल्शियम लेवल. So total serum calcium level is 9 to 11 milligram per deciliter. 9 to 11 milligram per deciliter. This is calcium level. Most of the parameter it is in the laboratory. What we do, it is in milligram per deciliter. Most of the parameter. Remember the total protein albumin it is in the grams, and the enzymes they are in the international unit per liter. So this is the common unit, 9 to 11 milligram per deciliter. Okay. So of this, the 50% is ionized form, and we can measure the ionized calcium by the ion selective electrode technique. एक standalone type of instrument रहता, that is known as electrolyte analyzer, and by the process that is known as ion selective electrode technique we can measure the ionized calcium level. Total calcium we can measure in the laboratory जो आपने perform किया होगा practical में. It can be by the OCPC, that is O-cresophthalin, OCPC, ओ क्रेसोप्थेलिन कॉम्प्लेक्सोन मेथड, या तो आरसी नेजो मेथड आपने यूज किया होगा, आरसी नेजो मेथड. These are the two common methods which are done in the laboratory for estimation of serum calcium, but nowadays it is now replaced by the ion selective electrode technique. Ion selective electrode technique which measures the ionized calcium. So total calcium it is 9 to 11 milligram per deciliter, 99% in bone and teeth. It is important for the formation of hydroxyapatite. Calcium and phosphorus together they form the hydroxyapatite, which is important for the mineralization of the bone. So it is important. Okay, the RD of calcium is 800 milligram for the adult. And it is the demand increases in the pregnancy and lactation, and it can go up to 1500 milligram per day in pregnancy and lactation. Also at the growing age the requirement increases. Then the sources, it is mainly milk and milk products, they are the important sources of the calcium. Now how the calcium level is regulated in our body, it is how it is regulated in the blood. So three important hormones they are important for regulation of blood calcium level, that is vitamin D, parathyroid hormone, and the calcitonin. Vitamin D, parathyroid hormone, and calcitonin. We'll discuss this calcium homeostasis, and these are the important functions of the calcium. Apart from the bone and teeth formation, it is required for the muscle contraction. Then it is a clotting factor 4. It is clotting factor 4. So it complexed with the gamma carboxy glutamate, negatively charged gamma carboxy glutamate of clotting factor 2, 7, 9, 10. The complex is formed which is important for conversion of prothrombin into thrombin. So it is important in the clotting process. So coagulation, it is factor 4 in the coagulation. It interact with the myosin, and it is important for the muscle contraction. It is important for the integrity and permeability of the cell membrane. It is second messenger in the hormone action which is via the IP3 DAG cascade, that is inositol triphosphate and diacyl glycerol cascade. It is important in the important second messenger in the hormone action. So it is important for the action of the most of the hormones. Calcium is important. Specifically the here it is important for the that is calcium is important. It is important for the action of the vasopressin, gastrin, cholecystokinin. So different group of the hormones are there. So it is important in the hormone action. Also, it is important for the action of glucagon, epinephrine, and also it is important. The calcium is important for the activation of various enzymes. How it is important for the activation of various enzyme? The one most important example here in the activation of enzyme, it is glycogen phosphorylase kinase. Glycogen phosphorylase kinase. So it is important in regulation of, it is important in glycogenolysis, degradation of glycogen. Activated glycogen phosphorylase kinase will activate the glycogen phosphorylase, which causes the degradation of glycogen. So it is important in nerve impulse transmission. For the nerve impulse transmission, calcium is important, sodium is important, potassium is important. Uh, Sodium, potassium, calcium, these are the important mineral which are required for the nerve impulse transmission. Also magnesium is important. Then it is important for the contraction of the heart, and it is also important in the endocytosis, exocytosis. So secretory processes, it is important. So these are the important functions related with the calcium. Bone and teeth formation, muscle contraction, clotting factor 4, integrity and permeability of the cell membrane, second messenger in the hormone action. It is required for the enzyme activation, nerve impulse transmission, contraction of the heart, and it is important in the secretory processes, that is endocytosis, exocytosis. So these are the important points related with the calcium. Now, how the calcium is level is regulated in our body? So there are three hormones which are important in regulation of calcium in our body, that is vitamin D, parathyroid hormone, and the calcitonin. So vitamin D and parathyroid hormone, they increases the serum calcium level, while calcitonin decreases the serum calcium level. Okay. Now see, blood calcium level normal range is 9 to 11 milligram per deciliter. So vitamin D increases the serum calcium level, parathyroid hormone increases the serum calcium level, and the calcitonin decreases the serum calcium level. Okay. So vitamin D and parathyroid hormone increases the serum calcium level. So main action here, see, vitamin D increases the absorption of calcium from the gastrointestinal tract. Vitamin D, how it acts? Vitamin D, uh, it acts as a hormone. It binds with the receptor present in the cytoplasm. So intracytoplasmic receptor it bounds, then it attaches to the hormone responsive element and increases the synthesis of calcium binding protein, and it increases the absorption of calcium from the GIT, gastrointestinal tract. Parathyroid hormone, it causes the demineralization of bone. Parathyroid hormone causes the demineralization of bone, and calcitonin, it causes the mineralization of bone. It opposes the demineralization of the bone. It causes the mineralization of bone. So by these are the main actions of these. Calcium absorption of the from the gut, it is increased by the vitamin D. It is indirect action of parathyroid hormone through vitamin D, and it increases the absorption of calcium from the gastrointestinal tract. Calcitonin decreases the absorption from the gastrointestinal tract. Bone resorption, it is by the parathyroid hormone, causes the bone resorption, while calcitonin causes the mineralization and vitamin D causes the mineralization of the bone. And the renal tubules, vitamin D causes increases the reabsorption of calcium and phosphorus. Reabsorption of calcium and phosphorus from the renal tubule. Parathyroid hormone, it causes the increases the reabsorption of the calcium, but increases the excretion of uh, this parathyroid hormone. It causes the reabsorption of the calcium and increases the excretion of phosphorus. Okay. And calcitonin decreases the reabsorption from the renal tubules. So see, Vitamin D and parathyroid hormone increases the calcium level. Calcitonin decreases the serum calcium level. Normal serum calcium level is 9 to 11 milligram per deciliter. If there is decrease in the serum calcium, it is known as hypocalcemia. If there is increase in the serum calcium level, it is known as hypercalcemia. Vitamin D, the main action is on the GIT, gastrointestinal tract. It increases the absorption of the calcium from the gastrointestinal tract. Parathyroid hormone main action is the demineralization of bone and increases the serum calcium level, while calcitonin opposes the demineralization. It causes the mineralization of bone. In that way, these three hormones are important and they act through three target tissues, that is the GIT, bone and the renal tubules. GIT, bone and renal tubule, they will act. Okay, just wait. So, what are the symptoms of hypocalcemia? Means 9 to 11 is the normal range. If it is decrease in the calcium, it is known as hypocalcemia. Hypocalcemia. And if it is increase in the calcium, it is known as the hypercalcemia. Hypercalcemia. So, what are the causes of hypocalcemia and what are the causes of hypercalcemia? So, hypocalcemia causes includes, now see, which hormones regulate the calcium level? Vitamin D, parathyroid hormone and calcitonin. Now see the important causes. Hypocalcemia means in the vitamin D deficiency means rickets, then osteomalacia, and when there is decrease in the parathyroid hormone, in this condition there is hypocalcemia, there is the calcium level decreases. When there is increase in the parathyroid hormone, like parathyroid adenoma or parathyroid tumor, there is increased parathyroid hormone activity and that causes the hypercalcemia. Also vitamin D toxicity, toxicity, then the metastasis in the bone, then fracture bones. In this condition hypercalcemia may occur. Or the cancer therapy, in the cancer therapy, increase in the serum calcium level occurs. So these are the causes of hypocalcemia and hypercalcemia. Now summarizing the calcium, see, the daily requirement of calcium is 800 milligram per day. Demand increases in pregnancy and lactation and it is 1200 to 1500 milligram per day. Now the RDA of the dietary sources of calcium is mainly milk and milk products. Then what are the important functions of the calcium? It is important for bone and teeth formation. The calcium along with the phosphorus, it is important for the mineralization of bone. Then it is muscle contraction, it is important. Then third is the it is a clotting factor for integrity and permeability of the cell membrane, it is required. Then it is second messenger in the hormone action, it is required for the activation of various enzymes. Then it is important for the nerve muscle conduction, it is important for the contraction of the heart, and the last one, it is important for the secretory processes. So these are the important functions of the calcium. How it is regulated? Vitamin D, parathormone and the calcitonin regulate the serum calcium level. And which case is related with the calcium? That is mainly tetany, that is carpopedal spasm, typical position of the hand when serum level goes below 6 milligram per deciliter. Now this carpopedal spasm, it is medical emergency and it is treated with 10% calcium gluconate bolus dose, 10 ml 10% calcium gluconate bolus followed by IV maintenance drip of the calcium. So this is important, it is medical emergency. 10% calcium gluconate 10 ml over the period of 10 minute, followed by the maintenance drip of the calcium. This is a treatment for the tetany, not tetanus. It is tetany, carpopedal spasm, and there are two signs which are related with the diagnosis of latent tetany. Latent tetany मतलब सिम्टम्स अभी डेवलप नहीं हुए हैं और सीरम लेवल इज बिलो 9 milligram per deciliter, but it is not below the 6 milligram per deciliter, that can manifest as tetany. The latent tetany it is known as. And for the diagnosis of latent tetany there are two signs. One is the Chostek sign, in which the tapping over the facial nerve causes the facial twitching. Tapping in front of tragus, it causes the facial twitching. And second one is the Trausius sign, in which the when we inflate the BP curve, there is this carpopedal spasm is produced on when we tight the BP cup, BP apparatus cup, and will increase the pressure. In that case, there is carpopedal spasm. So these are the signs of the latent tetany. So this is all about the calcium. Now we'll move to the second, that is the phosphorus. Now we'll discuss the phosphorus. So the requirement is same as the calcium. The sources, they are same. Serum level is 3 to 4 milligram per deciliter. 80% in bone and teeth, 10% in the muscle and RBCs, and 10% with other compounds. So this is regulated by vitamin D, calcitonin, and parathormone. But remember here, the parathormone PTH, parathormone increases excretion of phosphorus. Excretion of phosphorus. Parathyroid hormone causes excretion of phosphorus. Uh, it uh, it causes excretion of phosphorus from the renal tubule. It acts on the renal tubule and decreases the reabsorption of the phosphorus. So it is important for the bone and teeth formation. Then second important function of phosphorus is it is important component of DNA and RNA. DNA और RNA किस चीज के बने रहते हैं? Nucleotides. And nucleotides, they are composed of the sugar, that is pentose sugar plus phosphate plus nitrogen base. So there is phosphate in the DNA and RNA structure. So in DNA and RNA synthesis, this nucleoprotein synthesis, phosphorus is important. Then phospholipids, lecithin, cephalin, phosphatidyl, serine, threonine, then cardiolipin. The important phospholipids, there is phosphate, then phosphoproteins, there is phosphate. It is important for the phosphorylation of the enzyme and activation of many enzymes. The four important enzymes which are active in the phosphorylated states are glycogen phosphorylase kinase, ATP citrate lyase, and the HMG coenzyme reductase kinase and gluconeogenic enzyme. They are active in the phosphorylated state. So which is done by the attachment of phosphate to the enzyme. This is covalent modification in the enzyme activity, and by this mechanism number of enzymes, they are active. Then synthesis of high energy compounds, ATP, creatine phosphate. So it provides the energy, ATP, creatine phosphate. Then it is important intracellular buffer. Phosphate is the important intracellular buffer. That is disodium hydrogen phosphate and sodium dihydrogen phosphate. This is important intracellular buffer system. And coenzymes, various coenzymes, for example, thymine pyrophosphate, NADP, NADP, then the uh, pyridoxal phosphate. So for the synthesis of various coenzyme, phosphate is required. This is the only parameter which levels decreases after the meal. Phosphorus level decreases after the meal. बाकी सारे parameters के levels generally increase होते हैं. Phosphorus का level generally खाना खाने के बाद कम होता है. Okay, this is because of utilization of phosphate for synthesis of various compounds, for example glucose 6 phosphate, fructose 6 phosphate, and all. For the phosphate formation of phosphate compound, phosphate is utilized. So after meal, phosphate level decreases. So this is only parameter है जिसका लेवल खाना खाने के बाद कम होता है. So this is about the phosphorus. Now the phosphorus, all of you, ये आपको समझ गया होगा. तो आप इसके कॉजेस भी लिख सकते हो. 3 to 4 milligram per deciliter is the normal range. There is causes hypophosphatemia and hyperphosphatemia. So vitamin D, as the calcium and phosphorus levels, they are regulated similarly by the vitamin D. When there is decrease in the vitamin D level, as in rickets and osteomalacia, phosphorus level decreases. Parathyroid hormone, when it is increases, phosphorus level decreases, because parathyroid causes excretion of phosphorus. So see, so 3 to 4 milligram per deciliter is the normal. So decrease is known as hypophosphatemia, and increase it is known as hyperphosphatemia. Mia means blood. Mia means blood. Okay. So hypophosphatemia, decreased phosphate, it is seen in rickets, vitamin D deficiency, rickets, osteomalacia, vitamin D deficiency in the adult, then increase parathyroid hormone activity, because parathyroid hormone increases the excretion of the phosphate. So increased parathyroid activity causes the hypophosphatemia. And hyperphosphatemia, the causes are the vitamin D toxicity and decrease in the parathyroid hormone activity. So these causes the hyperphosphatemia. So these are the causes related with the phosphate. So this is all about the calcium and phosphorus. Just wait. हाय शिव्या सिंह, लिखोगे तो इंग्लिश में मेरे भाई, हिंदी में सुनोगे फिर भी। तो हमने कैल्शियम और फॉस्फोरस डिस्कस किया। सो कैल्शियम फॉस्फोरस रेगुलेशन लगभग सेम है। इतना याद रखना है कि फॉस्फोरस, देर इज एक्सक्रीशन ऑफ फॉस्फोरस बाय द पैराथायरॉयड हार्मोन। So increased activity of parathyroid hormone causes the excretion of phosphorus. This is important point to remember. Okay. Now calcium, phosphorus dietary sources are near about same. Milk and milk products, they are important dietary sources. Also RDA is near about same. The 800 milligram for the calcium and 500 to 800 milligram for the phosphorus level. Calcium normal range is 9 to 11 milligram per deciliter. Phosphorus normal range is 3 to 4 milligram per deciliter. It is 99% of calcium in the bone, 80% of the calcium in the bone and teeth. Okay. Now the regulation by vitamin D, parathormone and calcitonin, and phosphorus has its important function apart from the bone and teeth formation. It is important for the DNA and RNA synthesis. It is important for activation of enzyme. It is important component in the phospholipid synthesis. It is important in the phosphoprotein synthesis. It is important compound for the synthesis of various coenzymes, for example thymine pyrophosphate, NADP, pyridoxal phosphate, it is required. Then it is important for the synthesis of ATP and creatine, so high energy compound synthesis it is required, and it is important for the enzyme regulation, mainly the phosphorylation. So phosphorylation of many enzymes and activation of that enzyme phosphorus is required. If you understand the regulation, you can easily write down the causes for hypophosphatemia and hyperphosphatemia. ये आएगा तो शॉर्ट नोट आएगा, कैल्शियम आएगा तो LAQ आएगा, लॉन्ग आंसर क्वेश्चन आएगा अलॉन्ग विद द होम्योस्टेसिस ऑफ द कैल्शियम। कैल्शियम होम्योस्टेसिस में क्या लिखना है? तीन इंपॉर्टेंट टारगेट टिश्यूज, दैट इज बोन, इंटेस्टाइन, बोन एंड द रीनल ट्यूबुल्स। एक्शन ऑफ द थ्री इंपॉर्टेंट हार्मोन्स, दैट इज विटामिन डी, पैराथायरॉयड हार्मोन एंड द कैल्सिटोनिन, ये लिखना है। ओके। और कैल्शियम आया तो कार्पोपेडल स्पाज्म का ये भी लिखना। Okay, carpopedal spasm, the causes the decrease in the serum calcium level below 6 milligram per deciliter. Okay. Now the magnesium, the requirement is 300 milligram in case of the male, 350 milligram in case of the females. So this is 300 milligram in case of females and 350 milligram in case of the males. It is present in magnesium, it is present in the chlorophyll. So most of the vegetable, green leafy vegetable, it is present magnesium. So deficiency manifestations are quite less as compared to the phosphorus in related with the magnesium. So vegetables, milk, meat and cereals, magnesium is present. So near about 55% it is present in the bone and teeth. 55% of the magnesium it is present in the bone and teeth. Then regulation as such, the regulation is not important in case of the magnesium. It is regulated with the help of the aldosterone. Then so it is required for the bone and teeth formation. It is required for the activation of various enzymes that includes the glucokinase, hexokinase, phosphofructokinase enzyme. Then हाँ यहाँ पे लिखा है ग्लूकोकाइनेज, हेक्सोकाइनेज, फॉस्फोफ्रुक्टोकाइनेज, इनोलेज, ग्लूकोज 6 फॉस्फेटेज and adenylate cyclase for activation of this important, and also neuromuscular activity it is required. So these are the three important functions related with the magnesium: bone and teeth formation, activation of enzyme, and neuromuscular activity. These are the three important functions related with the magnesium. So it is widely distributed, so deficiency manifestations are rare. If there is deficiency of magnesium, it can manifest along with the calcium and phosphorus. So deficiency manifestations can be the spasm or neuromuscular irritability. Spasm or neuromuscular irritability, magnesium. Okay. Then the important one, also a part of electrolyte balance and imbalance, sodium. So sodium, it is present in the table salt, it is present in the cereals, legumes, egg, milk, and meat, but main source is the table salt. The requirement is 1 to 5 gram, 1 to 5 gram per day, but in case of hypertensive family, it is less than 1 gram per day for hypertensive family. इसलिए hypertension की हिस्ट्री जिनके घर में रहती है उनको बोलते हैं कि कम नमक खाओ. ओके, कम नमक खाओ. So serum level is 135 to 145 milligram per deciliter. Sorry, it is millimole per liter or milli equivalent per liter. 135 to 145. So this is important. This can be MCQ for your university examination. 135 to 145 milli equivalent per liter. This is major extracellular cation. It is major extracellular cation. Okay, major extracellular cation, and it is regulated by the aldosterone, renin angiotensin aldosterone axis. It is regulated by the antidiuretic hormone, renin angiotensin aldosterone system. It is regulated by the atrial natriuretic factor. These are the two important regulators. One is the aldosterone and second one is the atrial natriuretic factor. These are the important regulators for the calcium level. So sodium, potassium, and the chloride, they are required for the plasma osmolality. They increases the plasma oncotic pressure. They are important in the acid base balance. They are important in the water and electrolyte balance. All three: sodium, potassium, and chloride. Plasma osmolality, acid base balance, and water and electrolyte balance, they are important. They are important. Sodium and potassium, they are important part of sodium potassium pump. Sodium is required for the import of glucose, galactose, and amino acids. So, means it is required for absorption of glucose, galactose, and amino acids. So glucose, galactose, and amino acid absorption, it is required, and it is important in nerve muscle function. So sodium, potassium, calcium, magnesium, they are required for the nerve muscle function. So, and plasma osmolality, acid base balance, and water and electrolyte balance, sodium, potassium, chloride, these all three are required. Sodium potassium pump, the sodium and potassium, these are the important constituent. So how sodium is regulated in our blood? See, when there is decreased blood pressure or decrease in blood volume, it is sensed by the juxtaglomerular apparatus of the kidney. It is sensed by the juxtaglomerular apparatus of the kidney, and there is release of renin. There is release of renin, and this causes release of one important compound, that is angiotensinogen. Angiotensinogen. When there is decreased blood pressure or decreased blood volume, it is sensed by the juxtaglomerular apparatus of the kidney. There is release of the renin and angiotensinogen. Renin causes secretion of angiotensinogen. This angiotensinogen converts angiotensin 1 into angiotensin 2. Angiotensin 2. So angiotensin 1 is converted into angiotensin 2. It acts on adrenal cortex and causes release of important hormone, It causes release of aldosterone. Aldosterone. So aldosterone, it regulates the sodium, also it regulates the potassium level. Sodium chloride and potassium, it is regulated through the aldosterone. Now aldosterone act on the renal tubules. It acts on the renal tubules, distal convoluted tubules. It acts on the renal tubule. It causes the sodium reabsorption, sodium chloride reabsorption, reabsorption, and it causes the excretion of potassium, potassium excretion. So this is action of aldosterone. Sodium chloride reabsorption and excretion of potassium occurs via the aldosterone. So aldosterone is very important here for the retention of the sodium, and also this causes the retention of sodium. This increases the blood pressure. This increases the blood volume. Also, this angiotensinogen 2 directly causes act on the blood vessels, causes vasoconstriction and increases the blood pressure. So this is known as renin angiotensin aldosterone system. Renin angiotensin aldosterone system. Through the aldosterone, there is increased reabsorption of sodium and chloride and increased excretion of the potassium. So this is how sodium, potassium and chloride it is regulated by the renin angiotensin aldosterone system. This angiotensin 2, it causes the vasoconstriction. It causes the vasoconstriction and increases the blood pressure, angiotensin 2. Okay, so this is how renin angiotensin aldosterone system act. Then the second, when there is increase in the blood pressure, increase in the blood pressure or increase in the blood volume, stretching of the atrium is done. The atrium stretches. So there is release of atrial natriuretic factor. Atrial natriuretic factor. So atrial natriuretic factor, it decreases the aldosterone level. It decreases the aldosterone level, and it increases the, so it mainly decreases the aldosterone level, atrial natriuretic factor, and it also causes the smooth muscle relaxation. Muscle relaxation and vasodilation. Vasodilation. So this is again one mode where atrial natriuretic factor, it causes the vasodilation and decreases the blood pressure. Also it decreases the aldosterone level. So decrease retention of sodium, decrease sodium retention. Decrease sodium retention occurs. So this is how renin angiotensin aldosterone system will act, and this is how the atrial natriuretic factor will act. Okay, so there are number of causes of hyponatremia and hypernatremia. So normal level is 135 to 145 millimole or milli equivalent per liter, millimole per liter or milli equivalent per liter. If there is decrease in the sodium, it is known as the hyponatremia. It is known as hyponatremia. Decrease in the sodium. The causes includes vomiting, severe vomiting, severe burn, diarrhea, burn, then Addison's disease, adreno adrenocortical Addison's disease, adrenocortical deficiency, Addison's disease, there is hyponatremia. And the hypernatremia, hypernatremia. So there is increase in the sodium level, which is there in the Cushing syndrome mainly. It is in the Cushing syndrome. Cushing syndrome. Also there is Cohen's disease. or Cohen's syndrome, there is primary hyperaldosteronism. The aldosterone level increases and that causes the hypernatremia. So vomiting, diarrhea, burn, Addison's disease, these are the causes of hyponatremia. And the Cushing syndrome, there is excess uh, hormone. Because of excess of the corticoids, there is increase level of the sodium occurs, increased sodium level occurs. Also the Cohen's syndrome, primary hyperaldosteronism, Cohen's syndrome, there is hypernatremia. Okay, now see second, potassium, sodium, potassium. Potassium requirement is 1 to 4 gram per day. It is present in the fruits, bananas, and mainly in the fruits it is present, mainly in the bananas and the tender coconut it is present. The serum level is 3.5 to 5.0 millimole per liter, and it is major intracellular cation. It is major intracellular cation. Potassium, sodium, major cation in the extracellular fluid. It is major cation in the intracellular fluid, near about 160 millimole per liter. Here level is 160 millimole per liter. So it is regulated by aldosterone, corticosteroid, which causes the excretion of the potassium, and the potassium redistribution. When redistribution, it is depends upon the hydrogen ion concentration. It depends on the hydrogen ion concentration. If there is acidosis, if there is metabolic acidosis, there is hyperkalemia, and if there is metabolic alkalosis, there is hypokalemia. So it depends on the insulin level, potassium redistribution. So insulin channels, potassium channels, they are dependent on the insulin, which causes uptake of the potassium inside the cell. So it depends, it is regulated by aldosterone, corticosteroid, and the potassium redistribution, which is with the hydrogen ion concentration and the insulin level, which causes the potassium redistribution. So what are the functions of the potassium? So ये पहले तीन फंक्शन हमने ऑलरेडी बोले थे. It maintains the plasma osmolality. It is important for the acid base balance. It is important for the water and electrolyte balance. It is important for the sodium potassium pump. It is important for the resting membrane potential, RMP. It is important for the depolarization and contraction of heart. It is important for the secretion of HCl by the gastric juice. This is hydrogen potassium exchanger. This is with the help of exchanger, hydrogen potassium exchanger, and it is important for the nerve muscle function. तो common function है सोडियम पोटेशियम क्लोराइड के, प्लाज्मा osmolality, acid base balance, water and electrolyte balance. Sodium or potassium, they are important component of the sodium potassium pump, which is an example of primary active transport. It is required for the resting membrane potential, depolarization and contraction of heart. It is important for the secretion of HCl in the gastric juice via the sodium potassium hydrogen potassium exchanger, and it is important in the nerve muscle function. Okay, so potassium level 3.5 to 5.0 millimole per liter is the normal range. When there is decrease in the potassium level, it is known as hypokalemia. It is known as hypokalemia. And when there is increase in the potassium level, it is known as hyperkalemia. Hyperkalemia. Hypokalemia and hyperkalemia. So decrease potassium, increase potassium. Hypokalemia, hyperkalemia. Normal range is 3.5 to 5.0 millimole per liter. So remember, omitting loss of potassium from the gastrointestinal tract, that causes the hypokalemia. So omitting diarrhea, that causes the hypokalemia. Alkalosis. So hypokalemia is there in the omitting diarrhea, alkalosis, metabolic alkalosis, respiratory alkalosis, that causes the hypokalemia. Metabolic and respiratory alkalosis, because of potassium redistribution, it causes hypokalemia. And the Cushing syndrome. Cushing syndrome, there is hypokalemia. Hyperkalemia, it is mainly there is hyperkalemia, increase in the potassium level. It is mainly in the diabetic ketoacidosis, metabolic acidosis, lactic acidosis, because of potassium redistribution. metabolic acidosis, diabetic ketoacidosis, then Addison's disease. Addison's disease. So these are the causes: hypokalemia and hyperkalemia. Okay, potassium level. So remember that in diabetic ketoacidosis there is hyperkalemia, there is increase in the potassium level in the diabetic ketoacidosis because of potassium redistribution. In the diabetic ketoacidosis or metabolic acidosis, there is increase in the H ion concentration in the extracellular fluid, and to decrease the acidity, this hydrogen ion moves inside the cell. To decrease the acidity, this hydrogen ion moves inside the cell in exchange with the potassium. So potassium moves out, hydrogen moves inside the cell. So to compensate this, potassium moves out, and there is hyperkalemia in the diabetic ketoacidosis. But when insulin is given in the treatment, insulin causes the rapid opening of the intracellular potassium channels, and this potassium enters into the cell, and that causes rapid hypokalemia. So that's why potassium monitoring is required while giving the insulin therapy in the diabetic ketoacidosis. So this is about the potassium. Okay, sodium, potassium, and chloride, it is same as that of the sodium. See the requirement: 1 to 5 gram. Sources same: table salt, cereals, legumes, eggs, milk and meat. 96 to 106 millimole per liter is the normal range. It is major extracellular anion. It is major extracellular anion. Sodium was major extracellular cation. This is major extracellular anion, and it is regulated along with the sodium with the help of renin, angiotensin, aldosterone system. It maintains the plasma osmolality. It is important for the acid base balance. It is important for the water and electrolyte balance. It is important for secretion of HCl in the gastric juice. Because HCl, the chloride itself, is the content. It is also important in the chloride shift. Exchange of chloride with the bicarbonate in the RBCs, it is important. So it is important in the chloride shift. So this is all about the chloride: sodium, potassium, chloride. And one more is there, that is sulfur. So it is not too much important. Sulfur, it is present in the vitamins. Which vitamins it is present? So remember this can be a LAQ. It is present in the thiamine, it is present in the biotin, it is present in the coenzyme A, it is present in lipoic acid. These are the sulfur containing vitamins. Then sulfur containing amino acids are there, that is cysteine, cysteine, methionine. Cysteine, cysteine, methionine, it is present. Methionine, it is present in the glycosaminoglycans, that is heparin, it is present. Then chondroitin sulfate, dermatan sulfate, heparan sulfate, keratan sulfate, it is present. So it is present in the glycosaminoglycans. So it is present in the glycoproteins, glycosaminoglycans, it is present. Sulfur, it is important. It is important for the formation of disulfide linkages and orientation of amino acid in the protein structure. Disulfide linkage and orientation of amino acid in the protein structure, sulfur is important. Sulfur is important for the glycosaminoglycan synthesis. It is important constituent of vitamins. It is important constituent of the sulfur containing amino acids. It is important SAM, S-adenosyl methionine, methyl group donor in the sulfur containing metabolism. SAM is there, which is required for the transmethylation reaction. It is required for the transmethylation reaction. Sulfur containing amino acids, they are required for the transmethylation reaction. Okay, so these are the some sulfur containing compounds are phosphoadenosine phosphosulfate, which is the active sulfate group donor. This is active sulfate group donor. Then it is required for sulfur, it is required for the detoxification reaction. Sulfate detoxification reaction, it is important. It is important in the glutathione. So these are the important compounds which contain the sulfur. So this is in short about the sulfur. This is about the major elements. तो major elements किसको बोलेंगे हम लोग? जिसका 100 मिलीग्राम पर डेसीलीटर से ज़्यादा रिक्वायरमेंट है. When the RDA is more than 100 milligram per day, they are known as major elements. What are the examples of major elements? Calcium, phosphorus, magnesium, sulfur. calcium, phosphorus, magnesium, sulfur, sodium, potassium, chloride. Calcium, phosphorus, magnesium, sulfur, sodium, potassium, chloride. These are the major elements. Their requirement is more than 100 milligram per day. Calcium requirement 800 milligram, phosphorus requirement 800 milligram, magnesium requirement 350 milligram. Then sodium 1 to 5 milligram, potassium 1 to potassium 1 to 4 milligram, and the chloride 1 to 5 milligram requirement. The sources of calcium, phosphorus, magnesium, it is calcium, phosphorus. Calcium, phosphorus, the main is the milk and milk product. Sodium chloride, the main source is table salt and the food which is grown on seashore. That these are the major sources. Also the egg, milk, meat, these are the important sources for the sodium and chloride. Potassium, the main sources are fruits and the mainly that fruits is the tender coconut and banana, major sources of the potassium, major sources of the potassium. Calcium, phosphorus, it is regulated by the vitamin D, parathyroid hormone, and the calcitonin. So vitamin D, parathyroid hormone, increases the calcium level, while parathyroid hormone increases the excretion of the phosphorus. Increases excretion of the phosphorus. Sodium chloride, they are regulated by renin, angiotensin, aldosterone system. Sodium, potassium chloride, they are required for the osmotic balance. They are important for maintaining the osmotic pressure. They are important for the electrolyte and water balance. They are important for the acid base balance. Sodium potassium pump, sodium is required, potassium is required. For secretion of the HCl in the gastric juice, chloride is important. For the secretion, it is potassium, it is by the hydrogen potassium exchanger. Potassium is also required for secretion of the gastric juice, HCl in the gastric juice. Then for the absorption of sodium, glucose, galactose, and the amino acid, sodium is important. For the nerve muscle conduction, calcium is important. Then the sodium, potassium is important, and magnesium is important for the nerve muscle conduction. Okay, so bone and teeth formation, calcium, phosphorus, magnesium, it is important. Calcium, phosphorus, magnesium it is important for the bone and teeth formation. So this is all about the major elements, and major important case among this is the tetany, that is carpopedal spasm, when the serum calcium level goes below the 6 milligram per deciliter. Now we'll discuss the important topic, that is trace elements or the minor elements. स्नेहाजीत इसी साल में है अगर भाई स्नेहाजीत, तू पास नहीं हुआ क्या जो दोबारा फर्स्ट ईयर की वीडियो ले रहा है? हाय रमेश. Meat is the best source of protein. I know, man. Unconventional ASH. चोस्टिक साइन, ट्राउजियस साइन, जिनका वाइवा कैल्शियम के प्रैक्टिकल में अच्छा गया, उनको पूछा जाएगा व्हाट इज चोस्टिक साइन, व्हाट इज ट्राउजियस साइन. चोस्टिक साइन, फेशियल नर्व पे टैप किया तो फेशियल ट्विचिंग होती है. दिस इज नॉट फॉर द, जहाँ पे टिटेनी डायग्नोस हुआ है वहां पे ये काम का नहीं है. लैटेंट टिटेनी के केस में ये काम का है. And the Trousius sign is the, by inflating the BP curve, you can demonstrate the carpopedal spasm. That is the, these are positive in the latent tetany. Normal calcium level is 9 to 11 milligram per deciliter. There are three methods, important methods for estimation of serum calcium, that is OCPC and RC-NASO method. These are the colorimetric method. While the ion selective electrode method, it is based on the ion selective electrode technique, and the analyzer is known as the, on the electrolyte analyzer the calcium, ionized calcium is done. So ion selective electrode technique is the best for the estimation of serum calcium. So various precautions can be asked in the viva for the calcium estimation, क्योंकि उसके लिए स्पेशल ट्यूब्स आती जो कि कंटेमिनेटेड ना हो, क्योंकि वाटर में भी कैल्शियम है, तो कंटेमिनेशन ना हो, ऐसी स्पेशल ट्यूब्स आपको यूज करनी पड़ती है. ऊपर से वो पूरी ड्राई होनी चाहिए, वो इट शुड नॉट बी कंटेमिनेटेड विद द डिस्टिल वाटर। तो डिस्टिल वाटर यूज करोगे तो ऑलरेडी कैल्शियम के रिएजेंट को कलर रहता, वो पर्पल कलर रहता, और कंटेमिनेटेड यूज किया तो वैसे भी रिजल्ट नहीं आते। सो लॉट ऑफ प्रिकॉशंस नीड टू बी टेकन वाइल एस्टिमेटिंग द टोटल कैल्शियम लेवल। ओके, so now we'll proceed for the trace elements. So in the trace element, iron, copper, zinc, fluoride, selenium, manganese, and iodine, these are the important. So here clinical cases or clinical cases, they are more important than the SAQs and LAQs. So iron is very important topic. Iron, it is very important topic. Iron deficiency anemia. The laboratory parameters, they are very important in the iron deficiency anemia. Copper related with the Menkes disease and the Wilson's disease, it is important. Zinc, it is related with acrodermatitis enteropathica, growth retardation, spermatogenesis. Zinc is required for the test. Gustin is the protein which contains zinc. For the test, zinc is important. Wound healing, zinc is important. Fluoride, the deficiency causes the dental caries when it is less than 0.5 ppm, and when it is more than 2 ppm, it causes the fluorosis. Then selenium causes the Cation disease. Manganese and iodine, these are the important minerals. When the requirement is less than 100 milligram per day, it is known as the micro elements, it is known as the trace elements, minor elements, it is known as minor elements. When it is less than 1 milligram per day, it is also this is also included in the trace elements, but it is known as the ultra trace elements. Ultra trace elements कौन से है ऐसे एलिमेंट्स, अल्ट्रा ट्रेस एलिमेंट्स? इट इंक्लूड्स द सेलेनियम, सेलेनियम रिक्वायरमेंट इज सेलेनियम, इट इज आयोडीन, molybdenum, molybdenum, these are the ultra trace elements. Selenium requirement is in the microgram. So requirement here, iron, it is near about 10 to 20 milligram per day. Copper, it is 2 milligram per day. Zinc, it is 10 milligram per day. Fluoride, it should be less than 2 ppm particles per million, 1 to 2 ppm. Just wait. It is 1 to 2 ppm particles per million. It is present in the drinking water. Selenium, it is 50 to 200 microgram per day. Manganese, it is 5 to 6 milligram per day. And iodine, it is 150 to 200 microgram per day. तो these are the RDA, recommended daily allowance. ये एक के नीचे एक करोगे तो ही आपको याद रहेगा, नहीं तो ऐसे याद नहीं रहेगा. RDA. So important sources here, in case of the iron, the green leafy vegetables, these are the important. Per gram of the tissue, the content of iron is much more in the green leafy vegetable as compared to the meat. Okay, remember this. So green leafy vegetable, this is important source for the iron. For the copper, zinc, the important sources are milk, it is meat, shellfish, seafoods. These are the important sources for the copper and zinc. Then fluoride, it is present in the drinking water. Selenium, again, it is present in the seafoods, meat, fish, it is present selenium. Manganese, it is widely distributed. Iodine, it is present in the food grown on the seashore. And iodine, it is present in the mainly iodized salt, iodized fortified salt. Fortified मतलब ताकि उसकी डिफिशियंसी ना हो, इसलिए वो एक कॉमन जनरल फूड प्रोडक्ट में उसको मिलाया जाता है, फोर्टिफाइड. सो आयोडीन, फोर्टिफाइड नमक, दैट इज द आयोडाइज नमक, उसकी भी ऐड कितनी सारी ऐड आती है ना. So iodine. So these are the important topics we will discuss. So we'll start with the iron. In the iron, what is important? Why it is known as one-way element? Absorption of the iron is important. Different iron containing proteins, its transport and storage is important. Different laboratory parameter in the iron deficiency is important. Laboratory parameter in the iron deficiency anemia, it causes microcytic hypochromic. Microcytic मतलब छोटी RBC, हाइपोक्रोमिक मतलब हीम इनकारपोरेशन जो है उसका आयरन कंटेंट, हीम कंटेंट जो है वो कम है। माइक्रोसाइटिक हाइपोक्रोमिक आरबीसीज, आयरन डिफिशियंसी एनीमिया। पैलर, पैलर जो लोअर पाल्पेब्रल कंजंक्टिवा में देखा जाता है, दिस इज इंपॉर्टेंट साइन। एंड हीमोग्लोबिन लेवल विल बी लो इन द आयरन डिफिशियंसी एनीमिया। कॉपर डिफिशियंसी में भी एनीमिया होता है। इट इज ऑल्सो द because copper is required for the absorption of the iron, so copper deficiency also causes the anemia, but other features are more prominent in the copper deficiency. Zinc deficiency causes diarrhea, alopecia, dermatitis. Fluoride deficiency causes the dental caries. Selenium deficiency causes the cardiomyopathy, that is Cation disease. Cation disease. Manganese, as such, no disease is associated with manganese. Iodine deficiency causes iodine deficiency goiter. If it is deficiency of iodine in pregnancy, it causes the cretinism. It causes the cretinism, congenital iodine deficiency syndrome. Now, this is very, very important case. A 10-year-old girl presented with excessive tiredness. The non-specific symptoms अगर non-specific है तो go with the iron. Okay, see, 10-year-old girl presented with excessive tiredness, poor appetite, inability to concentrate and tingling sensation. Also there is decreased scholastic performance. क्लास में बैठे रहोगे, ये तो नॉर्मल फाइंडिंग है बोलना सर, क्लास में बैठे रहोगे आप पूरे भटकते रहोगे, आपका किधर भी ध्यान नहीं रहेगा, टीचर क्या पढ़ा रहा है कुछ ध्यान नहीं रहेगा. ओके, सो दिस कैन बी ए मैनिफेस्टेशन. अपैथी, डल चाइल्ड, this is a manifestation of iron deficiency. On examination there was pallor. Pallor means the मतलब ये lower palpebral conjunctiva natural light में जब हम देखते हैं, so it is towards the white color means pallor. If it is towards the red color means the hemoglobin concentration is good. ओके, लैब इन्वेस्टिगेशन रिवील डिक्रीज इन द हीमोग्लोबिन, तो हीमोग्लोबिन डिक्रीज हो गया. फेरेटिन एंड एमसीवी, डिक्रीज फेरेटिन, डिक्रीज मीन कार्पस्कुलर वॉल्यूम. So mean corpuscular volume near about 80 to 100 is the normal range, but it is decrease here. Hemoglobin decrease, ferritin decrease, and MCV level decreases. Total TIBC, total iron binding capacity increases. Which of the following is deficient? So zinc deficiency causes the rash, that is diarrhea, alopecia, dermatitis. Copper deficiency causes the Wilson's disease, Menkes disease, aortic aneurysm, CVS disorders and the anemia. यहाँ पे उससे रिलेटेड कुछ भी नहीं है, सिर्फ एनीमिया का पिक्चर है. Calcium deficiency causes the tetany. Iron deficiency causes microcytic hypochromic anemia, and this is typical peripheral smear picture in the iron deficiency anemia. And decrease in the ferritin level is the earliest manifestation in the iron deficiency anemia. Then decrease ferritin, decrease MCV, mean corpuscular volume, and there is increase in the TIBC, total iron binding capacity increases. Total iron binding capacity increases. So this is iron deficiency anemia. This is important clinical case. Now see, so it is the levels, iron levels, so RD of iron is 10 to 20 milligram per day. It is 10 milligram for males and near about 20 milligram per females. And in pregnancy and lactation level is 40 milligram per day, 40 milligram per day, iron level. It is present mainly in the green leafy vegetables. Remember it, it is present in green leafy vegetables. और थोड़ा सा हमारा दिमाग लगाने का, फूड प्रिपेयर्ड इन द आयरन वेसल्स, गुड़ जैसे बनाते हैं ना जागरी, it contain good amount of iron. Dry fruits contain good amount of iron. Dry fruits वो काले मनु का इसलिए देते हैं, मतलब प्रेगनेंसी में या जब भी आयरन लेवल स्लो है तो उसको रात भर भिगो के रखने को बोलते हैं और उसको खाने को या उसका पानी पीने को बोलते हैं. सो ड्राई फ्रूट्स इट इज मच मोर. As we consume pulses, cereals in larger amounts, this will also give you the iron. Meat, जागरी, ड्राई फ्रूट्स, बीट रूट भी खाने को बोलते हैं आयरन वाले, आयरन डिफिशियंसी वाले को. सो दीज आर द इंपॉर्टेंट कंपाउंड्स. ग्रीन लिफी वेजिटेबल, per gram of the tissue it is much more in the green leafy vegetable. Remember this iron. Okay, then these are the different iron containing proteins. और आयरन के जितने भी फंक्शंस है सब इसी से रिलेटेड है. हीमोग्लोबिन, मायोग्लोबिन, साइटोक्रोम सी, साइटोक्रोम ऑक्सीडेज, साइटोक्रोम P450, tryptophan pyrolase, catalase, nitric oxide synthase, xanthine oxidase, aconitase, cytochromes. These are the different enzymes Also, the transport and storage form of the iron, it is transferrin, it is transferrin, it is ferritin, it is hemosiderin. So these are the different iron containing proteins. Hemoglobin required for transport of O2, required for transport of O2 and CO2. Myoglobin, storage of oxygen. Myoglobin is important. Cytochrome, electron transport chain. Cytochrome P450, detoxification reaction. Tryptophan pyrolase in the tryptophan metabolism. Catalase, it is important in the removal of H2O2. Nitric oxide synthase. This arginine is converted into nitric oxide. Xanthine oxidase, purine nucleotide degradation, aconitase, Krebs cycle, and cytochromes. So cytochrome C, cytochrome oxidase, various cytochromes, complex 1, complex 2, complex 3, complex 4 of the electron transport chain. This is important. So various cytochromes it is present. So these are the iron containing proteins and the first functions of the, ऐसा आयरन के फंक्शन याद करोगे तो याद नहीं आएगा, लेकिन ये सब प्रोटीन्स अगर याद करोगे तो उसके फंक्शंस आपको याद आएंगे. So deficiency of iron causes iron deficiency anemia. So the symptoms: dull apathy, dull child, decreased scholastic performance, loss of interest in the surrounding. Then there is laboratory parameters which are important in the iron deficiency anemia. Hemoglobin concentration decreases, mean corpuscular volume decreases, ferritin level, serum ferritin level decreases, TIBC, total iron binding capacity, increases to transport the iron to the various tissues. Transferrin, total iron binding capacity increases. Okay, so this is increases and these parameters decreases. So iron deficiency anemia. So these are this is blood picture. In the laboratory picture, mean corpuscular volume, so it is microcytic hypochromic, microcytic, small RBCs, hypochromic, decrease heme, hypochromic anemia, microcytic hypochromic anemia, decrease hemoglobin, decrease MCV, decrease ferritin, increase TIBC, total iron binding capacity increases in the iron deficiency anemia. So what is again important in the iron is the mucosal block theory, and how iron is absorbed from the gastrointestinal tract is important. Mucosal block theory and how it is absorbed. Now see how the absorption of iron is absorption of iron is very important, and it is easy to remember. So don't do the complicated diagram. एकदम simple diagram है how iron is absorbed. Now see, so ferric food, it is present in the ferric form. In the food, the iron, it is present in the ferric form. This ferric iron is converted into ferrous form. So it is by the duodenal cytochrome B, or by the vitamin C, which causes the conversion of ferric iron into the ferrous form. So ferric is converted into ferrous form, and this is duodenal enterocytes. This is duodenal enterocyte. Now this is divalent metal ion transporter. This is divalent metal ion transporter. It is responsible for transport of the lead, copper, zinc, ferrous. These ions, these are transported by this DMT, divalent metal ion transporter 1. So it is important for the transport of iron in the ferrous form inside the duodenal enterocyte. Duodenal, remember, iron, folic acid, B12, iron, folic acid, B12, iron, duodenum, folic acid, jejunum, and the B12 ileum, site of absorption. Okay, so duodenum, this is duodenal cell, duodenum enterocytes. So it is absorbed via the divalent metal ion transporter 1. It is quite easy. Ferric is converted into ferrous. In the food, it is present in the ferric form, which is converted into ferrous form by the vitamin C. Then ferrous is transported along this transporter, that is divalent metal ion transporter, and it is incorporated into the intestinal mucosal cell. It apoferritin, it combines with the apoferritin, and it is stored as ferritin. It is stored as ferritin in intestinal mucosal cell in the ferric form. It is stored in the intestinal mucosal cell in the ferric form. This is ferritin. What are the sites where ferritin gets stored? Intestinal mucosal cell, spleen, bone marrow, liver. So reticuloendothelial system, it is stored. Okay. So ferrous, it is transported out of this intestinal mucosal cell. It is out through the transporter. They are known as ferroportin. Ferroportin, which is present on basolateral surface of the duodenal enterocyte. So ferroportin, which is responsible for transport of ferrous out of the intestinal cell, So here duodenal, it is divalent metal ion transporter 1, which is apical surface of the intestine, and the basolateral surface there is ferroportin. So hepastine is important to convert this ferrous into ferric form, and this ferrous form is again converted into ferrous. It is ferric form by the ceruloplasmin, peroxidase activity of ceruloplasmin. Ceruloplasmin, it is converted into ferric form. It is incorporated along with the transferrin. Transferrin and transported in the blood. Transferrin. In the ferric form, it is incorporated with apotransferrin, and it is converted into transferrin. So it is circulated in the blood in the form of transferrin, and it is stored in the reticuloendothelial system. It is stored in the reticuloendothelial system, spleen, liver, bone marrow. It is stored in the form of ferritin. It is stored in the form of ferritin. So this is liver, bone marrow, spleen. So these are the sites. Okay. So this is the absorption. Now it is known as one-way element because there is very less iron which is excreted from the body. It is from the sweat, hair loss, and the feces. Very negligible amount of iron is excreted from the body. It is utilized and reutilized by the body. It is utilized and reutilized by the body. That's why it is known as one-way element, also known as mucosal block theory. Mucosal block theory. There is utilization and reutilization of iron in the body. So this is how it is absorbed via the divalent metal ion transporter, and ferroportin is important, which is important for the transport of the ferrous from the intestinal cell into the blood, also from the macrophages. When heme degradation is there in the macrophages. So in from the macrophages, so via the heme degradation there is release of the iron, and this iron, it is out of the macrophages through the ferroportin. So ferroportin, it is important, and it is regulated by important peptide. It is regulated by important peptide that is known as the hepcidin. This is important regulator of the iron, which causes the, when there is excess of iron, it causes the internalization and degradation of the ferroportin. Internalization and degradation of ferroportin, hepcidin. So hepcidin regulates the iron level. It is a peptide synthesized by the liver. It decreases the ferroportin levels when there is iron excess. It decreases the ferroportin level. It causes the internalization and degradation of ferroportin channels, and that's why it decreases the absorption of iron from the intestine. Also it decreases the export of the iron, which is from the degradation of heme from the macrophages. So hepcidin is important for the regulation of iron level. So here mucosal block theory means one way element, because it is very less amount is excreted out from the body. It is utilized and reutilized in our body. It is absorbed through the divalent metal and transported out of the cell through the ferroportin. Ferroportin levels, they are regulated by the hepcidin. In the blood, it is transported along with the in the form of transferrin, and it is stored in the form of ferritin and hemosiderin. Hemosiderin is partially degraded product of ferritin, but it is very hard to remove the iron from the hemosiderin. Hemosiderin is the indicator of the iron overload, specifically in cases of repeated blood transfusion. Hemosiderin, it accumulates in the tissues and it is stained by the certain dyes, and hemosiderin is partially degraded product of the iron. Hemosiderin, it is the storage form of the iron, and it indicates the iron overload. Serum ferritin, it is a indicator of the iron status of the body. So this is early indicator. Decrease in the serum ferritin level is the early indicator of the iron deficiency anemia. Early indicator of iron deficiency anemia. So this is about the iron. Okay. So this is important. This diagram is important. Role of divalent metal and transporter is important. These are not specific for the iron, because it can transport the lead, copper, zinc also. Okay. See, it transports the divalent metal ions. Okay. So this is important here. Now see this case, this is important. Copper metabolism is important. Just wait. Ferroreductase is the enzyme. Ferroportin is the channel. Ferroportin is the channel. Okay. Ultra trace element seam. Yes, correct. Seam. Selenium, iodine and molybdenum. Ultra trace element. Generally आपको कोई ultra trace element पूछेगा नहीं. वाइवा में जिसको जो अच्छा स्कोर करेगा उसको पूछा जा सकता है. तो विटामिन मिनरल कैसे याद करोगे? तो सिंपल है, एक के नीचे एक लिख के समराइज करके चार्ट फॉर्म में लिख के आपको याद करना पड़ेगा. मिनरल्स, विटामिन्स, दोनों चैप्टर, आरडीए, उनके फंक्शंस आपको लिख के देखने पड़ेंगे. एक चार्ट बना के आईने के पास लगा दो. उसका चार्ट आईने के पास जहाँ पे हम बार बार जाते हैं वहाँ पे उसका चार्ट लगा दो. इजीली याद हो जाएगा. और थोड़ा सा प्रैक्टिस करो. मैं पहले भी बोलता कि मैथमेटिक इज इट इज़ लाइक मैथमेट बायोकेमिस्ट्री इज लाइक मैथमेटिक्स. उसको आपको प्रैक्टिस करनी पड़ेगी, लिख के देखना पड़ेगा. फ्लो चार्ट्स, डायग्राम आपको निकाल के देखनी पड़ेगी, तभी आपको याद रहेगा. नहीं तो आधी से ज़्यादा ज़्यादा चीज़ें जब लिखने जाते तब याद ही नहीं आती, बिकॉज ऑफ लैक ऑफ रिवीजन. 3-4 बार रिवाइज करने के पहले वो याद ही नहीं रहता. और डोंट चेंज यूर बुक नाउ. अभी अभी ये स्टेज पे कोई भी बुक चेंज मत करो. जो बुक पढ़ रहे हो वही बुक पढ़ो. अभी शिफ्ट मत करो एक बुक से दूसरी बुक से तीसरी बुक. कुछ फायदा नहीं होगा. एक ही बुक की तीन तीन चार रीडिंग लगती है. ओके. और पॉइंट्स लिख के देखो, वो ज़्यादा काम आएंगे आपके. ओके. एक हमने छोड़ दिया, हिमोसिड्रोसिस एंड हिमोक्रोमेटोसिस. ये तो इंपॉर्टेंट है, इस पे आते हैं. हिमोसिड्रोसिस एंड हिमोक्रोमेटोसिस. नाउ हिमोसिड्रोसिस मीन्स इंक्रीज इन द आयरन लोड. Hemosidrosis, increase in the iron load, and hemosiderin is the pigment which indicates the iron overload. Iron overload. So tissues, there is accumulation of hemosiderin pigment in the tissues. And hemochromatosis, it is the advanced stage where there is involvement of pancreas, involvement of liver, involvement of bone marrow is there. So there is triad in the hemochromatosis. Triad. कौन सा ट्रायड रहता? डायबिटीज, डिस्कलरेशन ऑफ द स्किन, ब्रॉन्ज डिस्कलरेशन ऑफ द स्किन, डायबिटीज, और तीसरा तीसरा क्या रहता? ब्रॉन्ज डायबिटीज जिसको बोलते हैं. तीसरा कंपोनेंट क्या है? सिरोसिस ऑफ लीवर. cirrhosis of liver, bronze diabetes, hemochromatosis. So bronze diabetes, so bronze discoloration of the skin, cirrhosis of liver, and diabetes mellitus because of destruction of the pancreas by the accumulated iron. Okay, hemochromatosis. So this is correct, this is ये correct है. और this is important case, ये हमने इसके पहले भी हमने ये डिस्कस किया है. जस्ट वेट. So, a 14-year-old boy was reported to clinic with chief complaint of jaundice, fatigue, muscle stiffness, tremor, and behavioral changes. Examination revealed an enlarged liver and spleen. The Kaiser-Fleischer ring was noted. 99% cases there is KF ring in the Wilson's disease. 99% there is KF ring. But if there is no KF ring, it does not exclude the diagnosis of Wilson's disease. Okay, so gold standard test for diagnosis of Wilson's disease is liver biopsy and quantitative estimation of copper in the liver biopsy. Quantitative estimation of copper in the liver biopsy is the gold standard test. Also, urinary screening of the copper. Urinary screening of the copper is important in the Wilson's disease. So, what is your probable diagnosis here? This is a copper metabolism affected. This is a disease that is known as Wilson's disease. Which organs are affected here? यहाँ पे organs are affected में यहाँ पे तो नाम दिए ही है, लेकिन it is also known as hepatolenticular degeneration. Hepatolenticular, lenticular means lens नहीं, it is lenticular nucleus of the brain. Okay, so liver and the lenticular nucleus of the brain is affected. So because of copper deposition, there can be a jaundice, can be hepatomegaly, there is mental symptoms because of affected lenticular nucleus of the brain. What are the causes of the disease? It is because of mutation in ATP7B. Menkes, यम पहले आता है इसलिए A पहले, menkes, it is ATP7A mutation and the Wilson's disease ATP7B mutation. दोनों का फंक्शन मैं बताता. What is the treatment suggested? It is penicillamine. It is a copper chelating agent which is given and symptomatic treatment is given. Behavioral therapy is needed for the mental retardation and the CNS manifestations. So RDA is 2 milligram per day. It is present in organ meat, green leafy vegetable, fruits, nuts, and shellfish. It is present. So copper is present in catalase, cytochrome oxidase, ceruloplasmin, ALA synthase, superoxide dismutase, tyrosinase, lysyl oxidase. हर एक के important functions है. It is present in the catalase, cytochrome oxidase, electron transport chain. This is important in the it is important in the metabolism of hydrogen peroxide. Cytochrome oxidase, electron transport chain. Ceruloplasmin, it is important for conversion of ferric iron into ferrous state. Because of peroxidase activities, ferric is converted into ferrous state, ceruloplasmin. And ALA synthase, it is the first step in the heme synthesis. This is how first step in the heme synthesis. This is how iron copper deficiency is related with the iron deficiency. Now see, ceruloplasmin, ferric to ferrous, उल्टा हो गया, यहाँ पे. It is ferrous to ferric form, and it is important in incorporation into transferrin. It is important. And second, it is important in the heme synthesis. So this is the reason, these two reasons are there for the iron deficiency in the copper deficiency. So a copper deficiency causes the anemia. Then superoxide dismutase, it is antioxidant function, cytosolic superoxide dismutase, it contains copper and zinc. Remember, cytosolic superoxide dismutase contain copper and zinc, while mitochondrial superoxide dismutase, it requires manganese for its function. So antioxidant function. Then tyrosinase, it is important in the melanin synthesis. And lysyl oxidase, it is important for the collagen cross-links formation. So it is important in the collagen synthesis. It is important in the synthesis of larger blood vessels, lysyl oxidase. It has role in the the formation of larger blood vessels. So that's why it defect in the copper metabolism causes affect the lysyl oxidase, and it can cause the aneurysm of aorta because larger vessels they are involved. So anemia is there, microcytic hypochromic anemia, previous manifestations, aorta is involved here, aorta is involved. Menkes disease, which is due to ATP7A mutation, hypopigmentation because affected tyrosinase activity, and Wilson's disease, there is copper excess. So we'll discuss these two. See, in the Menkes disease, there is ATP7A mutation, and what is role of this ATP7A? See, A comes first, M comes first, Menkes disease. So that's why it is Menkes disease, ATP7A. What is role of ATP7A? This is ABC transporter protein, ATP binding cassette transporter protein, and ATP7A, it is required for absorption of copper from intestine. So there is decreased copper level if it is affected. So it is required for absorption. A for absorption, it is required for absorption of copper from the intestine. In Menkes disease, this is affected. So there is neurodegenerative disorder. So it is characterized by wiry or steel hair, or it is characterized by brittle hair, hypopigmentation, mental retardation is there in the Menkes disease. So it is characterized by neurodegenerative disorder, so mental retardation, hypopigmentation, pigmented patches, hypopigmentation, and wiry steel hair or the kinky hair. Menkes kinky hair syndrome. It is the name. Menkes kinky hair syndrome. It typically affects the male. Then the Wilson's disease, it is due to ATP7B mutation. So ATP7B is the transporter protein which is required for incorporation of copper into the ceruloplasmin and excretion of copper into bile acid, it is required. Incorporation into ceruloplasmin and excretion into bile, it is required. So there is copper excess in the Wilson's disease, and this accumulates in the brain, that causes the brain symptoms, and it accumulates in the liver, that causes hepatomegaly and jaundice. Accumulation in the decimate membrane around the cornea, it gives the golden brown ring around the cornea, that is known as Kaiser-Fleischer ring, that is KF ring around the cornea in the decimate membrane of the cornea. KF ring in the decimate membrane, golden brown colored ring because of deposition of copper. Also in the deposition of copper in the lens gives the cataract, that is known as sunflower cataract in the Wilson's disease. So this is about the Menkes disease and Wilson's disease. Then anemia and involvement of the aorta, larger vessels because of affected collagen synthesis, because of affected lysyl oxidase level. Okay, so this is about the copper. Okay, now the zinc, पहले ही बता दिया मैंने तो. So a young child presented with history of rashes around the eyes and mouth. Then mother also complained of impaired night vision. Impaired night vision जब भी आया, so it is vitamin A activity. Okay, in the patient, and complained that the child fall down last month and the wound healing is not proper. Okay, this is symptom. Which of the following is deficient? Wound healing से related तीन चीजें मैं हमेशा पढ़ाते वक्त बताता हूँ. Hyaluronic acid is important for wound healing. Vitamin C is required for the wound healing. Then collagen is required for the wound healing. Collagen and zinc is required. So zinc, vitamin C or collagen एक साथ ही आ गया, and zinc is required for the wound healing. So wound healing is not proper. Which of the following is deficient? So here answer is zinc. Diarrhea, alopecia, dermatitis, delayed wound healing, loss of taste sensation, affected spermatogenesis, growth retardation, and this typical rash around the acral parts of the body, finger, nose, mouth, toes, perineal areas. There is it is involved in the rash which is caused by the zinc deficiency, that is known as acrodermatitis enteropathica. So zinc is very very important. It is present in more number of enzymes, so it has wide activity. So zinc, the requirement is 10 milligram. It is present in meat, milk, eggs, shellfish, grains, nuts and beans. It is present. Zinc, it is constitute integral component of number of enzymes, more than 300 enzymes it is present. It is present in carbonic anhydrase, superoxide dismutase, RNA polymerase, so it is important for the protein synthesis, ALA dehydratase, carboxypeptidase, alcohol dehydrogenase, alkaline phosphatase. These are the important enzymes, zinc containing enzyme. Zinc is required for storage of insulin from the beta cells of the pancreas. Storage and release of the insulin, it is required. It is important for release of vitamin A from the liver. It is important. So it is maintenance of vitamin A activity in the serum. It is important. Vitamin A level in the serum, it is important. It is important for the germinal epithelium, maintenance of germinal epithelium. So it is important in the reproduction. It is important for the wound healing. It is important for the immunity. Specifically, it is required for the B cell and T cell function. So it is important in the wound healing. And gustin is the protein which is a zinc metalloprotein which is important for the taste sensation. So these are the important role of the zinc. Zinc is the important short note. So very important short note. These are the functions of the zinc. So deficiency causes acrodermatitis enteropathica, where the dermatitis involving the acral means distal part of the body, finger, nose, mouth, toes, perineal area. This is involved and typically affect the infant. It will affect the infant. Then there is poor wound healing in zinc deficiency, hair loss, loss of taste sensation, and impaired spermatogenesis. These are the features of the zinc deficiency. So this is very important mineral, zinc. So this is about the zinc. Then iodine. Iodine, it is related with iodine deficiency goiter. So iodine is required for the formation of T3 and T4, and all the function of iodine, it is because of the T3 and T4 thyroid hormones. The RDA of iodine is 150 to 200 माइक्रोग्राम पर डे. माइक्रोग्राम इसलिए हमने इसको अल्ट्रा ट्रेस एलिमेंट भी बोला था. सो जहाँ जहाँ आयोडीन की मात्रा कम है जमीन में, तो वो उसको गॉइटर बेल्ट भी बोलते हैं. गॉइटर जनरली पहाड़ी एरिया में जहाँ का आयोडीन कंटेंट जो है सॉइल का वो पानी के साथ बह जाता है, तो वहाँ के सॉइल में आयोडीन कम रहता और वहाँ पे लोग ज़्यादा अफेक्ट होते. दैट इज नोन एज goiter belt. That is known as goiter belt. So it is present in seafoods, drinking water, आयोडाइज सॉल्ट. अभी तो सॉल्ट को आयोडाइज किया, फिर भी काफ़ी सारे एरियाज ऐसे हैं जहाँ पे लोग आयोडाइज सॉल्ट नहीं खाते, खुला नमक खाते हैं क्योंकि उन वो अफोर्डेबल नहीं है उनको. ओके. देन वेजिटेबल्स ग्रोन ऑन सी शोर, दिस कंटेन आयोडीन. It is important for the formation of T3 and T4, and T3 and T4 has very important function. Specifically, it is required for maintenance of basal metabolic rate. It is important for the synthesis of glucose. It is important for the synthesis of protein. It is important for the lipolysis. And T3, T4, it is important for the electrolyte balance, water and electrolyte balance. It is important. So these are the important functions of the thyroid hormones. So deficiency causes simple endemic goiter or iodine deficiency goiter, and if it is defect or decrease in the pregnancy for the prolonged duration, it affects the children. It causes cretinism where growth is affected and mental retardation is there. There can be precocious puberty will be there. So it is cretinism, means congenital iodine deficiency syndrome. The deficiency of iodine in pregnancy can cause the mental retardation, that is cretinism. So iodine, it is important for the thyroid hormone synthesis. Deficiency causes the enlargement of the thyroid gland. So in search of iodine, the thyroid cells enlarge and it causes the enlargement of the thyroid gland. So iodine deficiency goiter. Then fluoride. Fluoride, it should be 1 to 2 ppm particles per million drinking water fluoride content. सो फ्लूराइड टूथपेस्ट यूज़ नहीं करने का हर बार. हमारे वाटर में फ्लूराइड कितना है, कहीं कहीं जगह पे बहुत ज़्यादा रहता है और फिर से अपन फ्लूराइड वाला टूथपेस्ट यूज़ करते हैं. So remember, 1 to 2 ppm is the normal range. Range less than 0.5 ppm causes the dental caries, while the excess more than 5 ppm, more than 20 ppm causes the dental and skeletal fluorosis. So it is present in the drinking water fluoride. It is important for the development of the bone and teeth. Development of bone and teeth. So less than 0.5 ppm for prolonged duration of time causes the dental caries, because it is important for the formation of acid resistant layer. It is important for the acid formation of acid resistant layer on the uh, on the teeth. So it is important. Excess causes dental fluorosis, skeletal fluorosis. More than 20 ppm, 20 ppm, it causes skeletal fluorosis. Skeletal fluorosis. There is mottling of the enamel and teeth, and uh, the this genu valgum deformity, gums means the knees are stick together, genu valgum deformity, पूरा का पूरा गांव इन्वॉल्व रहता है, जनरली एक बच्चा इन्वॉल्व नहीं रहता, बहुत सारे 10-20 लोग कंटिन्यूसली इन्वॉल्व रहते या गांव अफेक्टेड रहता. सो दिस इज skeletal abnormality, that is skeletal fluorosis. Skeletal fluorosis, dental fluorosis can be there. There is chalky white or the mottling of the enamel or discoloration of the tooth may be there in the dental fluorosis when excess fluoride level is there. So more than 5 ppm causes the dental fluorosis, more than 20 ppm causes the skeletal fluorosis, and less than 0.5 ppm causes the dental caries. This fluoride. नाउ द सेलेनियम. सेलेनियम के 3 एंजाइम याद रखना है: ग्लूटाथियोन पेरोक्सिडेज, थायरोडॉक्सिन रिडक्टेज एंड डीआयोडीनेज. ग्लूटाथियोन पेरोक्सिडेज, thyrodoxine reductase and deiodinase. Glutathione peroxidase, it is important. Glutathione peroxidase, it requires the selenium. It is antioxidant function. Glutathione peroxidase, it is important for conversion of the that glutathione peroxidase. It is important for the it is having the peroxidase activity for the scavenging the hydrogen peroxide, H2O2. Glutathione peroxidase is important, and then thyrodoxine reductase, it is important, and the deiodinase. These are the 3 important enzymes which require selenium. The requirement is 50 to 200 microgram per day, so that's why it is also known as ultra trace element. So meat, seafood and liver, it is present, and the deficiency, it is particularly common in some areas of the Chinas where it presented with cardiomegaly or cardiomyopathy. So that is disease is known as Cation disease. So अगर कोई disease भी आता है, so just enumerate that what is Cation disease. It is a disease found in the certain areas of the Chinas because of decreased levels of the selenium, and deficiency of selenium causes the Cation disease, in which heart is involved and there is cardiomyopathy. There is cardiomyopathy, and right about the selenium. So selenium is required for the glutathione peroxidase, thyrodoxine reductase and deiodinase. Deiodinase. So 550 to 200 microgram per day. Glutathione peroxidase, it is required for scavenging the hydrogen peroxide, and for this activity reduced glutathione and NADPH and glutathione reductase is required. So selenium, important 3 enzymes. And the manganese. Manganese is important for the enzymes, various enzymes, activation of various enzymes. So mitochondrial superoxide dismutase, so it is having the antioxidant property. RNA polymerase, so it is important for the protein synthesis. Arginase, enolase, kinase and carboxylase, these are the enzymes which requires manganese. So 5 to 6 milligram per day. As such, the no deficiency manifestation is there in the manganese deficiency, but it can cause the growth and development problem and the rash or the dermatitis, but it is very rare because of the wide distribution. It is present in the meat, fish, pulses, vegetables and cereal. Manganese. Okay, so this can be MCQ purpose. This is important for the MCQ purpose, manganese. Okay, then some important MCQs are there. So zinc is a cofactor of which enzyme? So see, carbonic anhydrase zinc is required, lysyl oxidase copper is required, carboxylase kinase, this is kinase, and carboxylase, this is the manganese is required. Kinase, again this for the kinase activity, the phosphorus is also required. Phosphorus is required, also manganese is also required. So next, hormone that regulate the serum calcium level. So serum calcium level, so calcitonin, vitamin D and the parathyroid hormone. This is answer here. Then glutathione peroxidase contain which metal? अभी हमने discuss किया glutathione peroxidase, thyrodoxine reductase and the deiodinase. It requires selenium. It requires selenium. Cation disease is due to deficiency of the selenium, and one Cation-Beck disease. Cation, that is, this is Cation-Beck disease. Cation-Beck disease. This is due to the excess selenium activity. Also, other nutrients are also involved. There is Cation-Beck disease due to increased activity of selenium, and other minerals are also involved, but this is very rare. Okay, so Cation disease is due to deficiency of selenium. Zinc causes acrodermatitis enteropathica. Copper metabolism, Wilson's disease, Menkes disease. Iron deficiency anemia. Just wait. Some MCQs. Cobalt, it is required for the B12. B12, cobalt is required for the B12. Then molybdenum. Molybdenum, it is required for the xanthine oxidase activity, which is important for the purine nucleotide degradation. Xanthine oxidase, it is a target allopurinol drug which act on the xanthine oxidase. So molybdenum required xanthine oxidase. B12 required the cobalt. B12 required cobalt. Then the chromium, it is important. It is also known as glucose tolerance factor. It potentiates the action of insulin. Potentiates. Remember, for the release of insulin from the beta cell, zinc is required. For potentiating the action of potentiates the action of insulin. This is chromium. It is known as glucose tolerance factor. This is important MCQ. Only this MCQ is important related with the chromium. Glucose tolerance factor potentiates the action of insulin. These are the MCQ. B12 requires cobalt, xanthine oxidase required molybdenum, and chromium, it is known as glucose tolerance factor. It potentiates the action of the insulin. Okay. So summarizing the all minerals. Remember, summarizing the all minerals. So when the requirement is more than 100 milligram per day, they are known as the major elements. When requirement is less than 100 milligram per day, they are known as the minor elements or trace elements. Ultra trace element, when the requirement is less than 1 milligram per day. Less than 1 milligram per day. LAQ में क्या इंपॉर्टेंट है? कैल्शियम और आयरन. SAQ में क्या इंपॉर्टेंट है? जिंक, कॉपर, आयोडीन. Zinc, copper, iodine. This is important in the short note. This is important in the short note. Calcium में क्या important है? Calcium homeostasis. How calcium level is regulated in our body. Sodium, potassium, chloride. This is a part of electrolyte balance. Water and electrolyte balance. Sodium, potassium, chloride. It is a part of water and electrolyte balance. Then what is important in the iron? Absorption of the iron from intestinal mucosal cell, and how it is transported in the blood in the form of transferrin, and how it is stored. It is in the form of the ferritin. It is in the form of the ferritin, and iron deficiency anemia is important. Zinc, it is the various functions of the zinc, they are important. So zinc, they are important for the spermatogenesis, they are important for the maintaining the epithelium, they are important for the maintaining the vitamin A level in the serum, they are important for the taste sensation, they are important for the wound healing, okay. So deficiency causes the dermatitis, alopecia, diarrhea, alopecia, dermatitis, delayed wound healing because of the zinc deficiency. Okay, copper related with the Menkes disease, copper related with the Wilson's disease, and various enzymes. For example, cytochrome oxidase requires copper, ceruloplasmin requires copper, catalase requires copper. Then ALA synthase requires copper. Then lysyl oxidase requires copper. Tyrosinase requires copper. So copper activity is important, and related with this enzyme, their functions, they are important. Okay, Wilson's disease, Menkes disease, this is important. Iodine, it is iodine deficiency. Iodine is required for T3 and T4 synthesis. Deficiency causes the iodine deficiency goiter. Deficiency causes the iodine deficiency goiter. So trapping the iodine, thyroid enlarge, and that gives the swelling. That gives swelling in the front region of the neck. That is known as iodine deficiency goiter. It typically presents with the hypothyroidism, decreased T3 and T4 hormone synthesis, decreased T3 and T4. So there are symptoms of decreased T3 and T4. that is iodine deficiency goiter. So this is all about the mineral metabolism, major elements, minor elements. Do the particular MCQs, do the short notes, and do the two important LAQs, and practice the chart. Practice the chart of the minerals. So thank you all of you. This is all about the mineral topic, important aspects of the mineral topic. We discuss the all important points related with all important minerals. So this is all about the minerals. तो रिवाइज करो टॉपिक्स। एक छोटी सी डायरी करो, उसमें लिखो कौन से टॉपिक में क्या क्या इंपॉर्टेंट है। वो हेडिंग्स बार बार करो। आपके सिलेबस, यूनिवर्सिटी का सिलेबस देखो, उस हिसाब से पढ़ाई करो। यूनिवर्सिटी के सिलेबस के हिसाब से पढ़ाई करो। उसमें एक LAQ निकालो। जब आप सिलेबस लेके बैठोगे तो आपको समझ में आएगा कि यहाँ से कौन सा टॉपिक आएगा, क्वेश्चन एग्जाम में कौन सा क्वेश्चन आएगा, ये आपको ध्यान में आता है जब आप सिलेबस लेके बैठते हो। और वो LAQs में कौन से पॉइंट आते हैं वो आप एक बार जस्ट रिवाइज करो, लिख के देखो। जैसे जैसे कैल्शियम, जैसे कैल्शियम हम सोचते हैं तो कैल्शियम में हम RDA, ये 4 पॉइंट तो हर हर मिनरल के करने हैं, विटामिन के करने हैं। RDA सोर्सेस एकदम इजी है, RDA और सोर्सेस। फिर बचता क्या, बायोकेमिकल फंक्शंस और डिफिशियंसी मैनिफेस्टेशंस। सो कैल्शियम में और एक्स्ट्रा क्या करना है हमको, होम्योस्टेसिस। आयरन में हमको क्या करना है, एब्सॉर्प्शन, म्यूकोजल ब्लॉक थ्योरी, एब्सॉर्प्शन आयरन में, है ना। तो ये थोड़े से एक्स्ट्रा पॉइंट हमको पता चाहिए। जैसे मैं आपको एग्जांपल बताता, जैसे आप बीटा ऑक्सीडेशन अगर देखते हो तो बीटा ऑक्सीडेशन में क्या लिखना पड़ता, ये पहले हमको रिकलेक्ट करना है। क्या लिखना पड़ेगा बीटा ऑक्सीडेशन में, बीटा ऑक्सीडेशन में हमको लिखना पड़ेगा कि साइट कौन कौन सी है, कौन से ऑर्गेनेलिज में होता है, स्टेप्स कौन कौन से एंजाइम है, पाथवे कौन सा लगता है, एनर्जेटिक्स क्या है, रेगुलेशन कैसे होता है, और डिसऑर्डर्स कौन से है। तो ये मेन हेडिंग जब आपको याद आएगी तब उसके अंदर का कंटेंट आपको याद आएगा। थोड़ा सा प्रैक्टिस करो पेपर पे, आपको इजीली याद आएगा। जो भी आप मेहनत कर रहे हो वो उसमें और जान डाल दो। अभी यही टाइम है पढ़ने का। सो थैंक यू ऑल ऑफ यू। थैंक यू वेरी मच।